What is pneumatic retinopexy for retinal detachment? Have you ever wondered how doctors repair a retinal detachment? One method they use is called pneumatic retinopexy. This is a minimally invasive procedure that can be done in an office setting. It is particularly effective for certain types of retinal detachments, especially rhegmatogenous retinal detachments. So, how does it work? The process begins with the doctor numbing your to minimize discomfort. Next, a gas bubble is injected into the vitreous cavity, which is the gel-like space inside your eye. This bubble then floats up to the area where the retina has detached or has a tear. The gas bubble gently pushes the detached retina back into its proper position against the eye wall. To ensure that the retinal tear is sealed and to prevent fluid from getting through, the surgeon will use either laser photocoagulation or cryotherapy, which is a freezing treatment. After the procedure, it is crucial for you to maintain a specific head position for several days. This helps keep the gas bubble pressing against the detached retina, aiding in its reattachment and healing. The gas bubble will gradually absorb on its own over 4 to 8 weeks. The entire procedure usually takes about 30 minutes and is performed outside of a traditional operating room. One of the main advantages of pneumatic retinopexy is that it is less invasive than other surgical options, such as scleral buckling or vitrectomy. However, it is important to note that this method is generally suitable only for retinal detachments with tears located in the upper part of the retina. If the tear is in a different location, or if a patient cannot maintain the required head positioning, pneumatic retinopexy may be less effective or not recommended. After the procedure, some patients may experience mild eye irritation or redness, which can often be managed with over-the-counter pain relievers and artificial tears. Regular follow-up care is essential to monitor the healing process and ensure that the retina remains attached. If pneumatic retinopexy does not succeed, additional surgery may be needed. In summary, pneumatic retinopexy is a recognized and effective initial treatment for selected retinal detachments. It is less invasive than other surgical options, but it requires careful patient selection and strict adherence to post-operative positioning for the best outcomes. If you suspect you have a retinal detachment, it is always best to consult a healthcare professional for personalized advice and treatment options.